Mick Cooper, professor of counseling psychology at University of Roehampton, is a chartered psychologist, internationally recognized author, and leading figure in humanistic, existential, and pluralistic therapies. His work focuses on personalized and collaborative approaches to therapy, particularly with young people, and explores how counseling practice can contribute to social change and justice. He has authored numerous influential texts and co-founded initiatives such as the Pluralistic Practice Network and the Therapy and Social Change Network. Second presenter, Dr. Philippa Haynes, a postdoctoral fellow at Stellenbosch University, is a counseling psychologist whose work centers on mental health equity, workforce sustainability, and community well-being. Her research examines the professional lives and support needs of counseling psychologists across career stages and has informed initiatives such as South Africa's first CPD accredited mentorship program. Alongside her academic work, she contributes to teaching, professional leadership, and international research collaborations while maintaining a private practice focused on young people. So each will present about 30 minutes, and then for the remainder of time, we'll take any questions you may have. All right, here is Professor Cooper.
Thank you. It's really nice to be here, and thank you very much for inviting me along. So I'm going to do a talk entitled Welcoming the Other, which is about the kind of identity and the nature of counseling psychology and how we might think about it and make sense of what it means to be a counseling psychologist as opposed to other kinds of sorry, I'm just gonna as opposed to other kinds of psychologies, including clinical psychology. The talk it's based on a talk that a paper that I wrote a number of years ago, but that I've updated, and I will just I'll put the link in the chat when I've finished, so that if people are interested in the paper, they can have a look at it and read more about it. So if I start, let me share my. You can see my screen there. Yeah, is that okay if you screen share? Okay. So, welcoming the other, realizing the existential humanistic ethic at the core of psychological practice. And I guess what I want to do in this talk is really make the case for thinking about the identity of counseling psychology as being rooted in ethics and being about ethics in action. And I want to try and articulate some of the core values of counseling psychology as I would understand it, and also something of the kind of philosophical ideas and principles behind it, and then talk something about how those values, if we go back to the values of counseling psychology, how those can be as fully realized as possible. I think for many of us in the counseling psychology field, what makes our approach unique, what is really at the core of our approach, is that foundation in ethics. Ralph Goldstein writes that counseling psychology is unique in that its competencies are founded upon a philosophically oriented and explicit statement of values. I mean, obviously, ethics is there in all professional practices. In the UK, we have the BPS Code of Ethics, for instance, and every profession has its ethics. But I think what makes counseling psychology unique is that it's not just a practice with ethics, but it is the realization of a particular set of ethics around trustworthiness, around fidelity, around confidentiality. So we can think about many professions, being a doctor, being a educational psychologist, as having a kind of ethics foundation on which there is a practice built, and that practice is ethics. But I think what's unique about counseling psychology in many ways is that it is ethics as practice, that our practice itself is the expression, is the realization of a particular ethic. And I think that's the distinctive element of counseling psychology. So what is those core values? I mean, bringing together different writings and different thinkings around that. I think partly it's around a prioritization of the client's subjective and intersubjective experiencing, rather than, for instance, the therapist's observations, the therapist's expertise, or using measures. So that when we understand clients, we try and understand them within their experiencing and within their cultural experiencing, rather than, for instance, in terms of our observations or scores on a particular measure. I think the second value is that we focus on facilitating growth and the realization of potential, and on well-being, rather than perhaps a focus on treating pathology. There's an orientation towards empowering clients, and that empowerment is very much part of what we try and do as counselling psychologists. Again, rather than seeing it as an adjunct to mental health, it's an integral part of our work. Very importantly, I think there's a commitment to a particular way of relating that is based around principles of democracy, non-hierarchical. Not that we can't have expertise, that's very much part of our role, but it's an expertise in relation to the expertise of the other, rather than the therapist as being the authority in the room. There's very much a client appreciation of the client as a unique being, grounded in a particular cultural background, a particular cultural experiencing, but also that the client is not just their culture, is not just in a more kind of positivistic sense, an expression of universal laws, but has a uniqueness that we engage with, and otherness that I'll come back to. And also that we very much understand the client as grounded in a social, cultural, relational, embodied being, rather than looking in at the psyche as a self-enclosed, isolated entity that has maybe different parts. We may understand the self in different parts, but we also understand that self as being embedded in a cultural, social nexus. But what kind of links those core values together? Well, I think a number of people have said that the core essence of counseling psychology and what makes it distinctive is that it is rooted in humanistic values. And we can tie it in with work on humanism, people like Edward Said, who have written about humanism, a humanism that goes back to Rousseau and many earlier thinkers. Marx would be another humanist, particularly in his earlier writings. A humanism that sees as Marx said, Marx's favorite quote was that nothing human is alien to me. And I think the kind of articulation of humanism is something about that every humanity is in some way equivalent to my own. Not that it's the same as my own, but there's a valuing of the other as I value myself, if you like, the golden rule that runs back into nearly every religion, that the other's life is of value in the same way as mine is, which means a kind of valuing, a respect for the other, a understanding of the other, a recognition of the other as a being like me. We can also, though, if we think about what the kind of underlying kind of philosophy is, two philosophers that I want to spend a little bit of time on, who have articulated maybe something that's humanizing ethic. So one would be Martin Buber, who talks about the I thou stance. And in counseling psychology, I think understanding that as an expression of that being in an I thou relationship with the other, rather than intentionally I it. And when Buber talks about the I thou stance, he means being alongside the other in their experiencing, in their subjectivity, that it's not a gazing in on the other in a way that much psychology might do, a kind of measuring, a quantification of the other, but it's an alignment with the other in terms of their experiencing of the world. So that we're not staring at the other, we're not staring at our client, we're not glaring at, or we're not diagnosing. I mean, we may use diagnosis, I'll come on to, but that our gaze is not simply a diagnostic, technical, objectifying one, but it's one that tries to stand alongside the other and experience and see the world as they see it. If we think about the qualities that Buber talks about the I thou rather than the I it relationship, there's a humanization of the other. seeing the other as a being, a human being, rather than an it. And Buber writes about we can use the word he or she or they, but we're still talking about an it when we're in that I-it stance. There's a relating to the wholeness of the other, the subtleties, the edges, the nuances, rather than seeing them in past. There's an acknowledgement of the freedom, the choice of the other, the way that the other is acting towards their world, rather than seeing them in purely deterministic, whether that's behavioral or psychoanalytic senses. And again, those things may come in, but there's an acknowledgement also of that freedom. There's a meeting in the person in the present rather than just in terms of their past, in terms of what they have been, or what they might be, or where we want to take them, but who they are now. There's an individuation Buber talks about in the I thou is a relationship. It's an exclusive relationship with a unique other. And in our counseling psychology, being alongside the other, there's something fundamentally individuating about it, rather than a more diagnostic, generalized relationship to the other. Confirmation, as with Rogers, is unconditional positive regard, that there's a valuing of the other, and also that in our being in that relationship, that we are relating as a wholeness, that we bring our whole being into that relationship, not just our cognitions, for instance, but our affective being. We're there as embodied beings with our clients, that there's a willingness to take risks, to not just interact from a place of safety, certainty, knowing, having our kind of fixed schema, but being able to have some fluidity, flexibility, and a stance that is dialogic rather than monologic, in the sense that we interact, and we interact in ways that we don't necessarily know how they will out, that where they will take us, but because there's a fluidity, there's a flexibility, there's an uncertainty. The other philosopher I want to talk about is, who follows on very much from Buber, is Manuel Levinas, who sometimes it's said that Buber talks about I thou, whereas Levinas talks about thou I. And in Levinas's work, there's a even stronger privileging of the other than in Buber. And Levinas talks about a kind of ethic of, Levinas argues, in contrary to people like Heidegger and ontologists, as many of the postmodern philosophers have done, the most fundamental question of philosophy is not about ontology, it's not about being, it's not about knowledge and epistemology, it's about ethics, it's about how we relate to others. And Levinas, although he's not talking about therapy, has been used in fields like person-centered therapy to, because he really highlights the nature of an ethical relationship. And for him, it's about an ethic of respecting, honoring, and prizing something that he talks about as otherness. He uses phrases like the stranger, the widow, the orphan, to whom I'm obligated, very much like Buber draws from Jewish philosophical thought. And Levinas talks and particularly emphasizes in his writings, which isn't particularly easy to grasp, but I think it's very poetic and beautiful. The way that the other is always beyond our grasp, our understanding. If you think about it in terms of schema, that we might have particular schemas that we impose, or our projections, if you like, onto the world. But and the otherness means that, and an openness to the otherness means an openness to something that lies beyond our ways of processing, something that is always distant, always foreign, always strange, always beyond ourselves. And that overflows, as Levinas puts it, my kind of ideas. So we might have diagnosis, we might have ideas of, for instance, borderline personality, depression, trauma. All these ideas may be very useful, but the counseling psychology stance is one in which we allow something more to be there, and that moreness is the wholeness of the client, the otherness, the bit that we can't maybe quite touch, the unknown, the unconscious, if you like, in psychodynamic terms, but not in a way where we're kind of predefining what it is, in a way that's allowing it to be. So Levinas talks about a non-allergic reaction with alteriety, the idea that rather than being afraid of something which is other, that we allow ourselves to be in a space with it, that we don't neutralize the other to the same, that we don't fit it into our schema, that we renounce psychagogy, as Levinas. He has some very colorful terminology, Levinas, psychagogy. But I think what he means by psychagogy is the kind of ideology of psychology that fits everything into our psychology boxes and doesn't allow the other to be. So we're talking, I think, if we think about that kind of welcoming of the other as the heart of counseling psychology, it's not about a kind of superficial friendliness but it's about a stance that is radically open, that draws on all our knowledge, but beyond that has a kind of radical openness to that other. That means that we meet the client from a place of not fully knowing, as Ernesto Spinelli, the existential psychotherapist, talks about, a kind of unknowing, a willingness to be transformed in that encounter with our clients, and to hold that otherness, that unknowing, that mystery, that allows us to be in that ethical relationship. So that deep welcoming is the kind of core of therapy, and it's in being with the otherness of the client. It also supports the client to welcome their own alterity. Something I wrote about a long time ago was about this idea of clients, people, us having, do we have an I-thou relationship with ourselves, or is it more like an I objectifying relationship? And by being in that I-thou place with our clients, we can help them into that I-thou place to themselves and welcoming them back into human relatedness, into community, into being alongside the other. And also, I think maybe importantly, supporting clients to then also, through that modeling, to be alongside the alterity of others. Cohen writes, the road from mental illness to mental health is to regain one's obligations, one's responsibilities to and for the other. So as well as maybe understanding mental well-being in terms of being aligned within our culture and having that community engagement, but it's not just about receiving, it's also about enabling and empowering our clients to be able to give and to be able to give to their to be in community in a giving as well as a receiving way. I'll just talk a little bit about some of the implications then, as I would see it, of that kind of if we kind of stripping back to those ethics and then saying, well, what does that mean in terms of what counseling psychology is, how we develop it, what it should be looking like. And I think one is about seeing beyond diagnosis. Um, And again, it's not to say the diagnosis that which is more part of the kind of clinical psychology or educational psych role, although there's been some important challenges in that, like the power threat meaning framework. But it's about having some distance from diagnosis that while we might draw on those conceptualizations, that the ethical relationship doesn't reduce the other to a theme in Levinasian terms, that there's a non-allergic relationship with the being of the client that sits outside of that. So whereas in some psychologies there's a kind of convergence, there's a kind of centrifugal centrifugal movement inwards. In counseling psychology, I think there's also the centripetal movement outwards. I hope I got that the right way around. That we welcome the vastness and the richness of clients beyond their diagnosis. Meeting Levinas talks about meeting the face of the other, the kind of uniqueness, the specialness of the other in as kind of as a metaphor of the face. That everybody's face, you can talk about everybody's got eyes, you can talk about everyone's got ears, and yet each face is a unique configuration. In the same way that each person is a unique configuration, unlike any other. I just want to talk about a client, for instance. This is a case example of an African Caribbean client I worked with, who'd really been in the diagnostic system and had been in psychiatry, been very unwell, and had been through medication, and medication had been helpful for him. But also, he kind of really felt that he'd lost himself by being in that system. Um, on the one hand, he had an ambivalent relationship to it, which I think a lot of clients do. That on the one hand, that he felt was helpful, he felt the medication had been helpful for him, and he appreciated that. But there was also some anger about being in that system and kind of losing any sense of who he was or what was unique about him or what was different about the things that matter to him. Like he was very interested in philosophy, he was very interested in art, and those elements of kind of like thinking, uh, and how that kind of linked in and created some kind of identity. That was he really liked Beckett's plays, for instance. Obviously, this is disguise. He really liked Beckett's plays, and there was something there about when he kind of read that and he was moved by that. There was just no place for that, and in fact, there was a kind of tendency, a kind of dismissal of that because it was quite depressing, some of that. But actually, for him, that was really important. So the counseling psychology work, we met for a number of months, and it was really about kind of whilst kind of recognizing what he'd been through and the value of what he'd been through, also seeing him as a person, him recognizing himself a person who could go into episodes of real psychological problems, but also that he was something more, that he wasn't just that diagnosis, that there was a kind of development of pride in who he was beyond the diagnosis and also with the diagnosis. Also a kind of connection with his community and thinking more about his community. He'd really lost his sense of community by being in the psychiatric system and felt that he'd been defined in a way that was alienating to him. So some of the work was also talking about his sense of community, and what it meant for him to be black man, and how that was talking to a white man about his blackness. So it wasn't about kind of um, denying or dismissing diagnosis, but about seeing the person beyond the diagnostic label, and holding, welcoming that, and holding that kind of creative tension between the I thou and the I. Sometimes people misunderstand Buber that he was saying we should just be in the I thou and get rid of the I it, and he really wasn't. I mean, he recognised that we need to move between the I thou and the I it all the time, but that there and we need in this the kind of differentiation of the I it and that kind of itification to develop a deeper kind of connection often. But it's about working creatively and holding that tension. So the second thing I wanted to talk about in terms of what does it mean to go back to those values is about enhancing our responsiveness. Kind of thinking about the unique individual client that we work with, process of what we might call personalization, about tailoring, um, and the way that that person flows, and what is it that that person wants and needs in therapy, which is a lot of my pluralistic work has been about, and also recognizing that changes through the process. So rather than what Bill Stiles talks about kind of ballistic action, like we kind of set what we're going to do, and then that's it. The responsiveness is about kind of being changing and flowing with the client and checking in and getting feedback and doing things and seeing how they work, using ways of kind of understanding what clients want and need and then being responsive to that. In our pluralistic framework, we talked a lot about kind of ongoing dialogue with clients about the starting point for therapy is very much about what is it that they want from the therapy, and that counseling psychology, I think, in contrast, a more diagnostic based approach does start with what is it the client wants. Client maybe wants to develop their self-confidence. Actually, that's the most prevalent goals in therapy as a whole. They might want to work on their anxiety. We did research around clients who were diagnosed with depression, and actually their goals were incredibly varied, and the kind of problems they identified. So I think counseling psychology does start with what it is that that client wants, and also ideas that they might have about how we can get there in terms of the tasks or the methods or the style. That's not to say that clients always find it easy to talk about goals or tasks, but what we found in our research is that inviting into that space, and that, again, coming back to those core values about communicating to clients a respect and valuing of what it is that they want can be really appreciated. I think that also means that when I'm talking about humanistic ethic, I'm not saying that, counseling psychology is necessarily just person-centered or humanistic. We use CBT, we use psychodynamic, we use all these different ways, but it's rooted in a kind of humanistic ethic, which actually means sometimes recognizing that humanistic practices may not be the most appropriate. We found in our research, for instance, when you say to clients, how would you like therapy to be? A lot of clients say, I want something directive, I want something skills based. Even younger clients say that they want input and advice. So there's that differentiation there. So I think we can, we think about these different kind of spectrum. Um, like there's a kind of therapeutic spectrum about whether we're kind of more directive or less directive in the encounter. But then there's also about whether our way of being is more fixed or more responsive. And classical client-centered therapy, for instance, might be a non-directive way of working, but there's also certain fixedness about it in the sense that it's like I'm going to do this, and not all clients want a classical client-centered approach. Manualized CBT is also kind of fixed, but at the other end of the spectrum, directive. And I think counseling psychology is kind of goes from the directive to the non-directive at the therapeutic level because it's what you might say responsive, non-directive at the meta-therapeutic level. I think a third thing goes back to this idea of confirmation is about orientating to clients' intelligibility, their wisdom, their understanding that all psychologists who are interested in well-being as well as distress, and that seeing our clients not as problems to be solved, but as meaning-seeking, striving, directional. In some of my writing, I talk about this idea of directionality, that a kind of core existential value is that we understand clients as wanting to move in particular directions rather than being static object-like things in the sense of the I it. So we recognize client strengths and abilities, that we work with that and we're open to that. And I think that aligns counseling psychology really nicely with more contemporary approaches like the well-being agenda, kind of recognizing that people want to realize their potential, that mental health shouldn't just be about ill health. Also, for instance, the recovery agenda, kind of recognizing that you can have serious mental health challenges, but also you can have wellness, that these two things aren't opposite. It's about taking control of one's life. And I think that means moving from a kind of way of thinking about ourselves as a healer, where somebody comes into therapy and we turn them around, to really thinking our counseling psychology role. It's more like a kind of catalyst, that our work is about helping somebody speed up a process that they're already on. If you look at the evidence on what contributes to therapeutic outcomes, that is also really clear that far and away the biggest determinant of change in therapy is the client. And then after that, the relationship, which is kind of 50% the client, the orientation we know plays a smaller role, and the therapist even less. So, with 30% of change, but the client and 7% of change on average, obviously these are very much averages from the therapist, then it really kind of opens up to understanding that our work is about facilitating client strengths and helping clients capitalize on what they're already good at rather than compensating for difficulties. So there's a couple of other things. I think also giving psychology away is really important to think about as counseling psychologists. George Miller said, over 50 years ago, the secret of our trade need not be reserved for highly trained specialists. Psychological facts should be passed out freely to all who need and can use them. I can imagine nothing we could do that would be more relevant to human welfare, and nothing that could pose a greater challenge to the next generation of psychologists than to discover how best to give psychology away. Psychology shouldn't be something that we're kind of holding on to. It should be like a gift. And welcoming the other is about kind of, rather than just seeing it as something that's kind of locked in that room, that we can share our knowledge, developing skilled clients and helping clients think about how they can develop skills of learning, taking a kind of leadership role in developmental self-help programs and moving beyond the kind of one-to-one focus that many counseling psychologists do. It's a challenge because in many ways our approach is also very relational, going back to Bib is I thou. But I think part of being in an I thou stance with another is also being able to give and allow and to let that other grow in their own particular way. Just the last thing I want to talk about is developing the evidence base. I think counseling psychology, less so in the States, more so I think in UK and other places. Research, we can be a bit ambivalent about research, and often the research we do is predominantly qualitative, which can be really valuable. And I think partly that comes from that ethic about wanting to protect the uniqueness and individuality of the client from kind of overgeneralization, scientific reductionism, reducing people down to numbers that quant research does. But I also think we lose something there, because I think that research, all research, including quant research, can also give voice to clients. It can put clients' perceptions and experiences, even an RCT, very reductionist in some ways, but in other ways, it puts the client's voice central in terms of the client's experiences of therapy and challenges us. Research does present a particular position, but we always come to counselling work, therapeutic work, with a position, and research evidence can also challenge us as something distant, strange. And it can, when research is best, when it's genuine open inquiry, I think it can be something that can really be of value in that process of being with a thou, and that can be quantitative as well as qualitative. So I think, when we think about research, we can be thinking about quant and qual, we can think about well-being, we can think about research on the relationship. What does it mean to experience welcoming? How is that for clients? Also thinking about how maybe we can help clients be less stigmatized. So I think we have these unique areas and we need to think about how we can develop the knowledge base for that. And just to say, there's a book that I've done recently, just looking at those evidence. So I am going to stop there, but just to conclude, I'll put the link to the paper if you're interested in the chat. And just to summarize, really, I think counseling psychology, we're unique in the way that we realize ethics and thinking about what those ethics are, thinking about how our practice can be a way of going back to those ethics and realizing them further allows us to hold a unique identity and a unique place as counseling psychologists. So thank you for listening.
Good evening. I think, Mick, I'm going to take over from you there. Thank you so much for a wonderful presentation. And just, I think you did a wonderful job of articulating the professional identity of counseling psychologists. And I think where I'm going to sort of approach things from next is from a lifespan perspective and how that professional identity can change or be challenged at the different career stages. So I'm going to quickly open my slides. Okay. Right. I hope everyone can see my presentation. Maybe if you can give me, okay, great. Right, so perhaps just to start off, earlier, thank you for the introduction. And as you heard, my name is Philippa Hain, and I'm a counseling psychologist and a postdoctoral fellow based at Stellenbosch University in South Africa. And it really is an honor to be here this evening. So thank you for allowing me to talk on this topic. And perhaps to start off with, why I think I was invited to talk on this topic. My PhD was surrounding this work, where I think Charles, I saw you had logged in. My PhD was under the supervision of Prof. Charles Young. And Charles, please feel free to chip in at any point if you would like to. Okay. So where it all began, the idea to sort of pursue this topic. So it already starts when I had my interviews for my master's, and my question, my curiosity, my anxiety, I guess, was where are the candidates who had gone through training? Who are they? Where are they? And what are they doing after training? So once they're qualified. And I think the more I probed and had conversations with different educators, trainers, departments, the more I realized that there was um, less of a formal way of tracking where psychologists or counseling psychologists specifically went and what they ended up doing after the training. So a lot of focus on training, less so once they were sort of graduated and released into the workforce. And so during my master's year, I actually looked at the professional experiences of clinical and counseling psychologists together. And what came quite clearly out of that research is that their experiences were quite different. Even more so, there was less research available on counseling psychology as a profession, as a workforce, the challenges and support needs following training. So a lot of work on the training process itself, and then as a workforce, I think there were two papers that had been written. Charles again was pioneering that, but I think both papers were based on the same set of data. So there was a clear need to focus more on counseling psychologists. So I just wanted to touch on a definition of professional identity, and there are various models we could consider. But overall, there's three main commonalities between these models that we can agree on, and that is that professional identity is socially constructed, it is constantly evolving, and it's also context dependent. So identity, and specifically professional identity in this instance, is not something that we arrive at. It is something that we are constantly constructing. Okay, so looking from a lifespan perspective, we generally define the career stages as follows. So early, mid, and late career. Early career referring to less than 10 years of experience or being in the field from graduation, mid-career 10 to 20 years, and then late career being 20 or more years in the field. Interestingly, the APA had originally defined early career as 7 years or less, but they found that even at the 10-year mark, practitioners were still trying to navigate or consolidate their professional identity. So that was ultimately extended to 10. And so why look at psychologist experiences from a lifespan perspective? And this is really because career stages influence experiences, but also the challenges and support needs. Starting off with early career psychologists, as I mentioned, this is 10 years or less of experience, and this is a particularly vulnerable career stage. In fact, they say this stage in the professional lifespan has the highest attrition rates of counseling psychologists leaving the profession. And this is largely attributable to the difficulty in sort of establishing or consolidating a professional identity, but also finding work, which we will discuss in a little bit. That comes up quite frequently. And so the main focus or questions at this point are, am I competent? Do I belong? Is this the right path for me? And so there's a shift from supervision to independent practice, needing to find employment. And this could be in the sense of establishing private practice, but as well as sort of securing a job, financial pressures. So psychologists often into the workforce with kind of lower salaries at the start. They also face significant student debt that needs to be paid off. And there's also a large financial outlay that's often needed, for example, setting up a private practice, the time that's needed to set up a private practice, etc. A work-life imbalance is quite prominent at this stage, where work takes precedence, the challenge of building networks, feeling quite unprepared. And this is less so in the term, in the sense of clinical skills, but more in how to navigate the marketplace, how to market themselves, establish private practice, etc. And often facing feelings of self-doubt, imposter syndrome, disillusionment, so expectations of what their counseling psychology career should look like and what they would like for their career and what it actually looks like in practice. Early career counseling psychologists are also at high risk for burnout, and they also face unique personal challenges. And this could be buying their first home, deciding whether or not to have children, and establishing sort of the long-term partnerships, etc. We then move on to mid-career, said is 10 to 20 years. At this stage, counseling psychologists tend to increase their sense of confidence. They have an improved support network and are quite resilient at this stage, or more resilient. And so they're moving from a point of uncertainty to a professional identity that's more stable and consolidated. At this stage, the focus is then how do I sustain this profession, this professional identity? And we refer to boundaried generosity, so not giving out too much and throwing out the clutter, which I think is quite a lovely way of putting it. So deciding what their values are, but also aligning their roles with that. Whereas with early career counseling psychologists, they tend to kind of take what's offered to them because there are limited opportunities at the beginning. Whereas mid-career, I think they have more flexibility in that sense. So as I said, improved alignment between values, interests, and roles. There's greater self-trust, an improved professional support network, but there are increasing work responsibilities. The challenges at the mid-career stage generally revolve around career overload, so the risk of being spread too thinly, and then the personal challenge of balancing family work and increasing leadership roles. The late career stage is the final 20 or 20 years or more of practice. And the focus here is on leaving a legacy and contributing to the field in the way of contributing towards future generations. And usually at this stage, counseling psychologists have an established professional identity. So their sort of focus here is what remains of my work. There's also a sense of a loss of innocence where perhaps early career psychologists or even mid might have an eagerness, an idealism to do certain things, whereas late career psychologists might realize a sense of what is actually possible at that stage. So their focus is on mentorship, leadership, and giving back to the field. There's a high sense of or prioritizing of self-care at this stage. They're also preparing for retirement. So there's quite an emotional focus at this stage, a sense of loss of perhaps professional seniors who led them in their careers, but also of peers. And then personal challenges at this stage, focusing on health issues, perhaps elderly parents, children leaving the home, and navigating that. So what shapes early career experiences? And I've really tried to condense this into 3 areas. And the first being individual factors, the second training factors, and the third systemic factors. So individual factors, I'm just going to move this over here. They've shown that personality, self-care and coping strategies, academic accomplishments during the training period, and the ability to self-evaluate have a very strong impact on early career psychologists' experiences, but also the ability to consolidate or develop a professional identity. And interestingly, and I think Mick, this speaks quite well to what you said about the openness. So having openness, being conscientious and extroverted tends to fare quite well. Sleep hygiene, being able to use social support networks, having very clear work-life boundaries, which generally is a challenge at the early career stage, making time for personal activities, which all kind of makes a lot of sense. Then we have training factors. Interestingly, training programs with smaller cohorts, a stronger emphasis on supervision, and programs that offer diverse opportunities tend to produce counseling psychologists who experience more positive early career stage. And then financial support. So that could be in the form of bursaries, so not ultimately leaving with a high debt. Educators play an important role, acting as role models and mentors. So this is less formal than in terms of supervision. So supervision being structured, more evaluative, mentorship sort of a reciprocal or leading, a guiding. And then professional programs that also focus on professional socialization. And what we mean by this is helping candidates to understand how to navigate the marketplace, how to market themselves, how to secure a job, to kind of environments they'd like to go in, perhaps teaching business skills or in private practice, etc. And then also exposure to professional organizations. It was quite interesting. There was a study done in the US, and I think out of the APA, only less than 20% were actually early career psychologists. And this sort of came down to a lack of knowledge, but also less perhaps value of those organizations where support can be gained. And then lastly, just looking at systemic factors. So, of course, the influence of gender, race, culture, and socioeconomic status on professional identity. And we mean this in the way of understanding power, privilege, and marginalization sort of dynamics. Other systemic factors, we spoke about that there are major bottlenecks, and there was a study done by Kaslow and colleagues, I think it was 2018, where they found that there are two major bottlenecks in the professional lifespan, and that is from the graduate training to internship level, and then secondly, at the graduation to first job. And unfortunately, because of this bottleneck, many trained counseling psychologists then ultimately end up leaving the profession. Okay. So ultimately, what do we gain from this? Professional identity sits at the intersection of who we are, so as individuals, how we are trained, so professionally in our programs, and where we practice, so the context that we find ourselves in. So why is identity challenging in the early career stage? And as I touched on, it's really so a transition from going from the student role to a professional independent role. You're also exploring new roles, so trying to find your niche as well. So while the expectations professionally are increasing, your support is decreasing. There are internal identity struggles at this stage, so feelings of self-doubt, anxiety, imposter syndrome, and believing that the struggles are unique. So often due to the sense of isolation at this early career stage, psychologists tend to feel that they are alone, or they are, they're unique in this struggle. External identity struggles, they may still be viewed by colleagues as students, sort of fresh off the block. There's a pressure to perform still at the senior level, although they're quite new into the field, and a sense of just feeling generally behind in the workforce. And so why does this matter? Well, it impacts confidence, impacts career decisions, it impacts attrition rates of psychologists from the workforce. And so it's not a minor issue. Lacking a professional identity can lead to burnout. We've seen in the literature, and counseling psychologists leaving the profession, and long-term career dissatisfaction. So I wanted to just give you an example. I've spoken about what professional identity is, the challenges that are faced perhaps at the different early, mid, and late career stages. And now I wanted to briefly give you an example of how this can sort of play out within a certain context. And as I mentioned, so I'm based in South Africa. So this my PhD was based on South African counseling psychologists, but hopefully what we've spoken about, you can sort of see how it all connects together. But ultimately, my PhD was a mixed method study. It started off, so the first phase was a quantitative survey, which was distributed to the full list of counseling psychologists in South Africa. And the second phase was a qualitative sort of interview phase, where we then followed up by interviewing 10 counseling psychologists. And I'm not going to go too in depth into the method, but more interestingly, just to focus on the results, we found significant differences. Oh, and perhaps just to note that in our study, just for ease, and also the focus was on early career counseling psychologists. We collapsed the mid and late career sort of career stages into one, which we refer to as established. So we found significant differences in age, race, geographic location, highest degree acquired, and languages spoken between early career and more established counseling psychologists. And we found that early career counseling psychologists, so as a workforce, were significantly more diverse than their more established colleagues. In terms of work settings, this was also quite interesting. So we found quite varied employment patterns, but in South Africa, and I know this is unique, where the majority of counseling psychologists specifically tend to practice privately. I think the most similar country at a global level would be Australia, in terms of the majority working in private practice. But there's been a huge move or recognition that specifically in South Africa, private practice is unfortunately it caters towards a privileged minority, where 80% of the country actually relies on the public health system. And so there's a need to shift from private practice to other settings. And we saw this in the early career psychologists. 80% had tried to find work outside of private practice, compared to established only 36%. Okay. In terms of career satisfaction, this again aligns with the literature, but early career psychologists were significantly less satisfied than their more senior colleagues in terms of their income, so lower starting salaries, their work setting, employment opportunities available to them, and also their work-life balance, where work was sort of taking precedence for early career psychologists. Interestingly, both groups were equally satisfied with their choice of counseling psychology as a profession. And when we followed up with the interviews, we found this was largely attributable to the altruistic nature of counseling psychology. So the work itself was very satisfying, very rewarding. But what was sort of frustrating or leading to dissatisfaction were the regulations, the more systemic issues surrounding counseling psychology in South Africa. Both groups were equally dissatisfied with the support that they received at an early career stage. And interestingly, almost 50% of both groups said that they would choose clinical psychology over again if they had the chance to. So these are the findings from the interviews. There were three main themes. The first theme referring to the complexity of finding and securing work. So participants reflected feelings of poor work readiness. And again, this doesn't necessarily refer to their clinical skills, but more how to navigate the marketplace, the workplace, setting up a private practice, becoming registered as well. So I think credentialing, licensure, how to, or where or who, which organizations to join. Limited employment opportunities, we've spoken about that, and varying levels of career satisfaction. Second theme was looking at different challenges. So many of the counseling psychologists grappled with professional identity conflict. Something that was quite interesting is that the majority had found themselves in counseling psychology, not necessarily by choice, but by the fact that they had sort of applied clinical programs, counseling programs, and then counseling psychology just happened to be where they fell, they were selected for. So still grappling with should they be in clinical, should they be in counseling. A sense of subordination and a lack of knowledge of counseling psychologists' professional identity. So this was by the public in general, but also by other healthcare practitioners. So working in multidisciplinary teams was often very difficult for counseling psychologists, especially at the early career stage where they needed to perhaps speak up or voice what their identity and their role is in those teams. Financial challenges, work-life balance demands. Another interesting finding, so the COVID pandemic, we had just finished off, I think, with the data collection, and many early career psychologists were trying to establish themselves, their private practice at this stage, where understandably they hadn't had any training, for example, in online therapeutic processes, so sort of navigating that. And then again, I assumed, so this is more South Africa specific, but a strong contemplation of immigration due to poor work opportunities, apparent hierarchy, so clinical psychology viewed as more superior, false hierarchy, and then safety concerns. And then the final theme was a sense of self-acquiring support. So early career counseling psychologists felt like that there were limited support structures in place, but that they were able to gain support through personal therapy, reaching out for supervision, which wasn't always necessarily easy. So finding a committed, available, and knowledgeable senior colleague to supervise them, and then also having the finances to pay for that at an early career stage. The one exception, again, this was interesting, is if they entered in a group private practice setting, they found this was quite a supportive space. This is my last slide, but really just recommendations on how to support early career psychologists through this transition, specifically counseling psychologists. Early career psychologists are urged to engage in self-reflection, to seize opportunities where possible, to be proactive in securing support and maintaining a healthy work-life balance, so being quite strict in that sense. Training programs encouraged to recognize the early career stage as an extension of the training program. So rather than sort of not tracking the follow-through, I guess, that it should be and that was one consideration, where if we could give a counseling psychologist a tracking number from their training right through, where we could see where they are, who they are, and what they're doing, it would, in terms of workforce trends, be very important. I think that's my last point, actually, conducting routine data collection on workforce trends to guide policy advocacy and utilization of counseling psychologists. So I think I'm going to leave it there and hand back.
Okay. Well, thank you both, Professor Cooper and Dr. Haynes, for your presentations on the identity development of counseling psychologists. So now we can open up to anyone who has questions or any comments. You can unmute your microphone, and you can actually ask questions, or you can type in the questions in the chat box as well.
Perhaps I have a question for the more senior colleagues. I don't know if the early career experiences resonate at all, if you remember how you felt as an early career counseling psychologist.
It was interesting to hear, I think some of the experiences of early career professionals. I still do think that there are some seasoned practitioners who also experience that sense of imposter syndrome, particularly in new environments. So I'm not particularly sure whether that is something that travels with professionals. Or I guess I'm saying I'm not sure that it's unique to early career professionals, because I do think that at times even seasoned professionals also embody that sense of I don't know what I'm doing, or I don't know what, should I be here, kind of a thing. I don't know what other people think.
Yeah, I had a discussion with some colleagues about this a few years ago, and we make out imposter syndrome to be such a bad thing. But one of my colleagues replied and said she worries about psychologists who don't suffer from imposter syndrome, that perhaps they become too complacent, they're too sort of self-assured, and they stop engaging in reflexive practice. So a little bit of self-doubt could be a useful thing in helping psychologists to reflect on what they're doing, to reflect on their level of training, and kind of it keeps them sharp. And so it keeps you focused on what you're doing. So a little bit of self-doubt may not be entirely a bad thing.
There's interesting research about humility as a practitioner, showing that therapists who have more humility have better outcomes, which I think is really interesting research that's come out recently about kind of the importance of humility as a practitioner. Love yourself. Was it the title of the paper was "Love Yourself as a Person, Doubt Yourself as a Therapist"?
I have a question. I'm curious as to how the I, it, and I, thou and the ethics of what you were talking about, Mick, how does that kind of fit into the idea of counseling psychologists as professionals, and how we might develop our own individual identities, not just in relation to the client work, but how do we see ourselves in terms of us as professionals?
That's a really good question. What was your thinking, Yutunda?
Ah, come on, Mick. I don't know. I'm asking you.
No, I will. I will. But in asking that, I imagine you had some thinking about it, and then I'll follow on from that.
I
Or
guess I was
maybe.
just curious about the dynamics of the welcoming and the openness of the other in relation to, I mean, depending on, the foundations of our training. Some people say that the experience of almost deconstructing yourself and doing the training and becoming a professional and then putting yourself together. So I was curious as to whether or not perhaps as professionals, depending on what career stage you are, might the I and I other and I it, might they somewhere conspire in developing that professional identity at some stages you will see yourself as the other in relation to the client. Does that make sense?
So a little bit more, not totally. I think I'm just trying to get my head around this really interesting area. You're kind of talking about, because I guess the focus with the I thou is on the, with both of them is, Buber and Levinas is on the other, isn't it? Rather than the self and the self-development. Or it is on the self-development, but if you compare it with something like Rogers, where the focus is more on self-awareness, something like Buber's focus is more on that engagement with the other, which then it is on development, but it's in development through that engagement, that openness, that being towards the other. So compared with a kind of ideology of that we look inwards and we kind of learn about ourselves, it is a bit different from that, I think, and it's kind of would challenge that a little bit because
Mhm.
it's a kind of relational standpoint rather than a kind of more solipsistic one. But I think at the same time to be in relation. Well, it's an interesting question, really. What is it? What are the self qualities that are needed to be in relation with the other? I guess when we think about that thing about wholeness, it does require some kind of integration. and some
Mm.
awareness of the whole of ourselves. I think it's very difficult to be in relation to the other if we're not aware of our feelings and we're not aware of kind of if there's big kind of blocks or big unconscious elements. So yeah, no, there is that developmental agenda, but I guess it is a developmental agenda for the work with other, which I guess is what we do as counselling psychologists, isn't it? It's a development for the other rather than development for the sake of itself.
Mm. Mm. But the idea that we also as therapists develop, I think, concurrently with our clients.
Yeah.
I guess my mind was trying to sort of assimilate ourselves in relation to the other and how we conceptualize what that looks like
Yeah.
in practice.
Yeah, no, we definitely, there is that focus on, we do develop, and that self-development is really important. But I guess it is also a question about like what self-development, if you think about something like self-disclosure,
Mm,
which I know is a very different topic, but I guess what we'd say is that self-disclosure is it's in the service of the client and
mm,
the service of the other. And I guess personal development as a therapist is also about personal development in the service of another,
mm,
but
mm,
also for ourselves, I guess. It's very, I mean, from the evidence, it's very unclear what kind of self-development does actually support the other. Like, there's no relationship with how much therapy a trainee does and how good their outcomes are. So I think we're still learning a lot about what might be the relationship between uh, our own therapeutic change and how we work with clients. Interesting
Probably
area.
I have question and maybe comment as well. And question about the identity of a counseling psychologist into practice. And I don't know in other country, in US kind of context, and um, if you accept insurance, particularly, and also in the US context, and they are looking for evidence-based treatment, and insurance for controlled kind of industry, and you're supposed to utilize evidence-based treatment approach, and wonder how we can. I think it's been probably struggle as a counseling psychologist, and how we can incorporate that counseling psychology identity and approach into this evidence-based kind of approach.
Yeah, I really think so. I mean, it doesn't naturally sit, and that kind of standardization runs against the kind of personalization agenda that I was talking about. I mean, having said that, I think the work on personalization is developing a lot. So, for instance, some of the psychotherapy researchers in the UK and the US is showing now that personalized therapies outperform standardized therapies, and that if you take into account, I mean, they're still working on kind of things like demographic characteristics, but if you take into account those qualities of the client, then you can produce better outcomes. So I think that might start finding its way into kind of insurance companies' thinkings, that recognition that actually, we do need to tailor and personalize the practice. And I think that sits much more comfortably with counseling psychology because I think we all know different clients need different things, but
Yeah.
we're still learning a lot about who needs what and how. And I think that's where counseling psychology research could really be coming in helpful, like on the personalization agenda. And I think it goes back. I mean, I get into a bit of a rant about this, but going back to what you were saying, Yutinda, is like I think in counseling psychology, a lot of our research is very introspective. It's about the kind of journey, like, a lot of students will do research on things like the journey of the counseling psychologist into professional practice. And that is important, but I think also there's a danger with very reflective work that we're not looking at kind of what helps our clients and what allows our clients to change and that kind of personalization. Like if the agenda was also focused on issues like personalization, which I think that could be really helpful.
Yeah, totally, I agree. I think that's particularly in the evidence. I think you're right. Yeah, it shows through different researches, and so um, we need more research based on counseling psychology approach and what you're talking about, the sort of the client-oriented, person-oriented kind of approach. And I have a comment about Dr. Haynes' questions, and the challenges early career psychology experience, whether it's imposter syndrome or lack of mentorship and all those kind of things. Actually, I think that continues. I think we've been talking about with my colleagues here too, that whether you are in the mid career and then late career, still it is needed and helpful if you have your mentors who have gone through that sort of phase of your professional identity and development. And because it feels different, as you talked about different kinds of characteristics of in different career path, career stages. And so as mid-career and late career, I'm kind of in between now, but I feel like it'll be really helpful for me too if I have continue to have mentors and I can connect with my mentors. And also depends on your career path. For example, I've been working at University Counseling Centers like almost 20 years before I started my full-time private practice. And so I was with a career within the counseling center, University Counseling Center setting. Well, I didn't know much about private practice, full-time private practice, actually, before I started, right? So I still need that kind of thing. So I think it depends on the career path and so not, just because I've been in the field for 20 years, nobody can assume, or I cannot assume myself that I know everything about private practice because I never really exposed.
Yes, yes. And I really appreciate your comment on that, because that's something that we found with the mentorship program we set up, where we matched early career with more established colleagues. And where you would assume, well, one would assume that it would be the senior colleague mentoring the early career. The senior colleagues reported also benefiting hugely so from the engagements, where they said it almost it gave fresh perspectives, where also they've been out, they're now exposed or engaging with practitioners who are fresh out of training, where it's the latest training and knowledge, etc. They're at the forefront of the counseling psychology approaches in a sense, or giving different perspectives. The workforce itself is changing, so I think I completely agree with you.
We
So
have, I think,
Jason had a
question. Yeah,
question.
Jason.
Yes. Hi. I'm a counseling psychologist based in Washington, D.C. And my research base during my program was vocational psych, so I have a lot of interest in careers and whatnot. One thing I'm curious, Philippa, for you, if this is something you encountered, and forgive me, I was on a commute back home for some of this, so it's possible you covered this. But I'm a second career psychologist. I had a first career for about 10 years and something else entirely. And so I find myself in this juxtaposition of, in some ways, I'm very much early career. I'm 3 years post PhD. In other ways, I feel like a mid-career professional. I'm middle-aged, in terms of lifespan. And so it's a very different feel. And I find that the way that I experience my early career is different. I don't know if there's any research out there on that. If it's also unusual, maybe in other countries, to be a little bit older and to start counseling psychology as a program. There is very much a phenomenon in the US of people becoming therapists as a second career, but they tend to go the social work route or the licensed professional counseling route because, once you've been through a career, you don't want to spend 6 years, except for me, in a career change like this to get set up. And so I'm just curious if you have any information on that.
Yeah, sure. So I think that's really interesting. I think from my study, all 10 counseling psychologists that we interviewed, I don't think one of them had chosen counseling psychology as a first option career. It was kind of a second choice or a second career. So I think I don't know in terms of the literature, but that's what we found too.
Yeah, interesting.
I think it's also interesting, certainly in my experience in the UK, quite a lot of people have counseling psychology as their second career. I've met a lot of counseling psychologists who have been policemen, who've been teachers or social workers, or other CBT therapists who are now kind of wanting to be more situated within a psychological framework, rather than just having a counseling background. So in my experience in the UK, I don't know, Mick, what you would say, whether you would agree with that.
There is another question in the chat box. I may read off the question. So, can I ask how threatened or not do you think is the professional identity of the counseling psychologist in relation to the use or not of AI?
Okay, I'm happy to come on to that. Sorry, say that again. You're asking me?
I was wondering what, in your experience in the UK, whether you're familiar with how many, you probably don't know how many in its entirety, counseling psychologists, people choose counseling psychology as a second career.
Yeah, it's not it's a significant minority. I think it's probably, I mean, a second career, that's not including people who kind of like been psychology researchers or done kind of worked in psychology services. I'd say probably about 30%, something like that, from a training perspective. It's quite a few going as a second career. And I think it really helps to build on that kind of knowledge. Root can serves a really good function often, that it gives strength. Just on that one, I mean, I think the one about AI is really interesting. I was at a conference on this recently. I did an article also about kind of relational depth and can AI have relational depth? And I kind of went into it with an open mind and came out with a thinking that really that given that relational depth is about genuine human care, that actually it can't. And actually, I think AI opens up, talking about the I and the thou. I think because AI can do so much of that it work in terms of diagnosis, in terms of formulation, in terms of CBT techniques, so much of that kind of more manualized, standardized bit can be replaced with AI very, very effectively. But, with AI, we always have to ask the question, well, what is it that humans can do uniquely? And I think by definition, what humans can do uniquely is care and relate and being a relational depth with someone that by definition AI can't. AI can't care. It can't matter to it what happens to the client. And there's things that we know for clients are really important. So I think I think counseling psychology can really thrive in a world of AI. I think relational approaches can really thrive because that is what is irreplaceable. Actually, I think clinical psychology is going to struggle more because a lot of that kind of role. So I hope we grasp that, and I hope it means that we gravitate more towards a kind of relational I-thou perspective, because somebody's going to need to do that, and it ain't going to be AI by definition. So I feel quite optimistic about it, actually.
For me,
Thank you.
Yeah, thank you. For me, also, I'd like to be optimistic about this development of AI, but I'm not so sure. But I think I'm a little bit mixed about this AI development, and so from my prediction, I think people will continue to push forward with this AI technology, and I'm pretty sure there are some companies who will develop AI therapists, so to speak, therapists, counselors, and they look like us, they talk like us, and but of course they will come with some consequences and the questions about the liability issues, other kind of who is going to control this kind of things. How do we call this? Is this therapist? Or is a counselor? What is it? And I know that in this country, in the U.S., coach is not really regulated legally here. So someone call themselves coach, and not like us and psychologists and counselors. This is a legal term in the US. It's you cannot call yourself psychologist unless you have license. So so there will be some complications, but my prediction is that there will be AI therapist like this. Right now, some of my clients actually using AI help while receiving therapy from me, counseling from me, and then we talk about it. So how was it for you? And then we talk about it in the session too. And then we talk about these things too that, well, my prediction is there will be maybe AI therapists in the future, more sophisticated one. Who would you choose in the future that you have options like this? And then majority of my clients say that, yes, of course, you. They say that. I don't know if it's because of that, I'm talking to them directly or, but there will be these options, I think, for other people. And so this is interesting question, actually.
What are
Thank you.
your thoughts, Jacinta?
Oh, I'm struggling with the whole concept of AI. I have to admit, and I'm heartened to hear the reference to the relational, because that is what I believe the unique work of working with a client is all about. Now, I'm not in practice at the moment, but I teach psychology to undergraduate degree students in the Republic of Ireland.
Mhm.
So I'm currently engaging with students in their final year on a counselling psychology module. So they are asking questions about AI, and of course they are the generation, the younger students using AI. But yeah, so no, I think holding on to the relational aspect. And actually, thank you to both speakers, because I've been really, really, I suppose, grounded, because my first introduction to counselling psychology was my first lecture in my master's in counselling psychology in Trinity College in Dublin. And we were told that it's grounded in developmental psychology. So there's your theoretical basis, which has always been quite steady and reassuring. And it's really reassuring for students, I think, to know that there's a body of knowledge to understand the client and the context and the transitions that they are trying to grapple with. So I think it's really interesting then that the career, your presentation on the career was based around, a developmental, a lifespan perspective as well. So I really, really enjoyed this evening. And thank you. Just really enjoyed it. I was teaching until 5 o'clock, the counselling psychology, and I said, "Oh, I'm going home to do more." So I was really excited. So thank you. Thank you.
Well, thank you so much. I know that we have maybe a minute or two. I don't know if there's any last question or any comments.
Yeah, I think the question is really it's important because just as some of us who've been around long enough rebelled against the use of computers, we like typewriters, and we've had to embrace the technology. We've had to embrace the internet, and I think we need to kind of embrace AI, but make it work in a way that it's our servant. It needs to be a support system. There was a comment at one AI seminar I attended a few months ago where it was said that possibly in 5 years' time, it may be considered unethical to not use AI to enhance one's practice. So, yeah, I'm taking the leap next month. I've signed up for a package called Nora. It's actually hosted by a company called Healthbridge in South Africa, but basically it does SOAP notes. And it's going to relieve me of the burden of having to sit and scribble out my own notes, and it will basically monitor the conversation in therapy and will then basically transcribe and capture the salient points. So that's work in progress. I don't know if it's going to work, but I'm going to give it a try. But it might be wonderful. But yeah, if we can use it to our advantage, it should never. I don't think it ever can replace us. It can't take the place of the therapist. But I think it's something that we need to kind of grapple with and figure out, how do we make it our servant?
Okay, well, Christina, you wanna share your thoughts? I think you typed in.
Yes, I just the final one. I'm not sure who else is here from Australia, but just I'm at the end of my career. Initially began in counselling psychologist as a very young psychologist before I was hit my 20s. It took mid-20s, so and have grappled with this idea that that Philippa spoke of is what is our identity and how does it develop over time. And a lot of work does need to go into, particularly into counselling psychologists here in Australia, to understand what is unique about what they offer. And Mick, you've talked a lot about that relationship with your client, and many of the clinical psychologists who come to me for their registrar program are wanting to develop those skills because they know that their application for treatment is limited when they're working with an individual, and they need to understand much more about what is unique and honour their client to be able to just find what the way in which they will become healthier and in their own life. So yeah, we do have something very unique to offer in our understanding, and we're not very good at articulating it to others beyond our profession, I think, beyond our area of practice. Yeah.
Well, thank you for sharing your thoughts, Christina. I think with that, we are mindful about our time here. I think we need to wrap it up. And again, thank you again, presenters, Professor Coopers and Dr. Haynes. And then thank you all for participating in today's webinar. And we'll try to actually provide multiple webinars throughout the year. So, well, probably we can see you again. With that, you take care.
Hi, everyone.